Although there are many clinical prediction models available for use in cardiology practice, these models usually do not take exercise capacity into account, mostly due to the lack of appreciation among clinicians for its prognostic utility, even though the American Heart Association has recently advocated exercise capacity as a clinical vital sign. Therefore, in this study, our main goal was to develop a prediction model for survival among coronary artery disease patients using health conditions beyond cardiovascular risk factors, including maximal exercise capacity. Hi, my name is Cristina de Souza e Silva, and I'm a medical director of the Exercise Medicine Clinic in Rio de Janeiro, Brazil. And I'm going to give you the highlights in the study that we performed: prediction of mortality in coronary artery disease, role of machine learning, and maximal exercise capacity. This study was conducted in a cooperation with University of Calgary, University of Illinois Chicago, Stanford University, and the Federal University of Rio de Janeiro, and it will be published at Mayo Clinic Proceedings. So ischemic heart disease is the leading cause of death worldwide. Accurate identification of high-risk patients provides opportunities to better inform patients about expected risks and to make the appropriate decision on patients' clinical management. Productive interactions between healthcare providers and data scientists were undertaken, and simple machine learning techniques were used to enable the evaluation of nonlinear interactions between all potential prognostic factors included. So data from 13,000 individuals who had been referred to a cardiac rehabilitation program after being diagnosed with coronary artery disease were analyzed. Our data set had information on demographic characteristics, clinical information such as comorbidities, baseline exercise test results, indication for cath, left ventricular ejection fraction, number of SSDs, management strategy for coronary artery disease. So for feature selection, our initial step, we applied random survival forest, sequential forward selection, and k-means. The reason we chose these techniques was for their simplicity, so we avoided black box solutions, and the possibility to work with sensor data. From this initial step, we found that exercise capacity and age were consistently identified as the most important variables from the total of 25 variables included for analysis. They outperformed variables that are commonly used in clinical practice for decision-making, such as the presence of comorbidities, extent of coronary artery disease, left ventricular ejection fraction, and so on. So for the predictive model, we used only these two variables: maximal exercise capacity, that was indexed by peak metabolic equivalence, and age, and we applied the survival tree algorithm. The root node was split by METs below or equal to 6.15 or above 6.15. Each individual subgroup was further split by age or other MET cut points, and the mean C index of the predictive model was 0.72. Moreover, to make our predictive model more practical, we generated Kaplan-Meier curves for up to 21 years of follow-up of 3 different age ranges according to METs achieved by approximating the cutoff points found by the survival tree algorithm. So after these observations, we reassured that exercise capacity should be viewed as a clinical vital sign, and this study makes its underutilization in healthcare settings unacceptable. So we invite you to read the details of this study that will be published at Mayo Clinic Proceedings, and thank you for listening.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.